So the ICH guidelines have really sort of changed the playing field on a global scale for this industry. I just spoke up in Toronto and at the global GMP conference up there, and clearly there is an adoption of the ICH guidelines and a clear understanding that the guidelines represent for the world marketplace the basic requirements for quality and for product development and for the integration of quality by design and quality management. So when you have something that far sweeping and that global, the interpretation is going to vary. And we're seeing some pretty significant variation across the industry. More often than that, that's really a byproduct of the fact that we have different industry drivers. If you're in Canada and your profit margin is 8% as a generic, it's very different than when you're in the US and your profit margin on a branded generic might be 85%, much like a branded pharmaceutical. So consequently, your emphasis on efficiency and stability and process predictability is going to change. So because of that, you find a different interpretation and depth of implementation of the ICH guidelines out there. But in all cases, embracing the basic tenets of the ICH guidelines is going to put a company or an organization in a position to be successful in this rapidly changing marketplace. So whether it's a two-man spin-off from the university attempting to craft a quality system and a product development system that's defensible for an IND, or you are a Fortune 50 pharma biotech company going on to a line extension or global product launch, how well you integrate Q8, Q9 as part of your existing process is going to dictate the success you have in that marketplace. And so we will see differences across industry. I think that's to be expected. This is the challenge auditors from the agency are going to have, the FDA, the EMEA, are going to have in attempting to interpret the guidance and its implementation in your factory. And I think that's to be expected, and there's nothing wrong with that.